XY ready, XY ready, XY ready.
You're attending a medical camp in Moranga and you observe a young boy struggling to get up as shown. What is the name of this sign and which condition is it associated with? Pause here and attempt the question.
Gower's sign. It describes a patient who must use his hands and arms to walk up his body in order to achieve a standing position. This is due to weakness of the proximal lower extremity muscles, such as the gluteus muscles and the quadriceps.
It's Gower's sign, Duchenne muscular dystrophy. What protein is affected in this condition and why does it only affect boys? Pause here and attempt the question. It only affects boys because it has an X-linked recessive pattern of inheritance. Boys only have one X chromosome, so defective X chromosome genes are always expressed. Its etiology is an absent dystrophin protein. What condition is associated with a partially functional dystrophin protein? Pause here and attempt the question. A partially functional dystrophin protein is associated with Becker's muscular dystrophy. On general examination, you observe that his calves are unusually big. What is the name of this sign and what is the pathophysiological basis? Pause here and attempt the question. It's the pseudohypertrophy of the calves. Absent dystrophin causes cellular signaling dysfunction, which leads to necrosis of affected muscle cells, which are replaced with connective tissue and fatty tissue. Affected muscles are weak even though they appear larger, that is pseudohypertrophy. What are some investigations that can be done and what would the results show in this condition? Pause here and answer the question. You could investigate increased creatine kinase levels. You could conduct genetic testing for the dystrophin gene mutation, or you can conduct a muscle biopsy to investigate the necrosis of muscle tissue and its replacement with adipose and connective tissue. Duchenne muscular dystrophy has no cure and tends to have a poor prognosis, with most patients dying in their 20s. What are some of the supportive ways of management? What are the most common causes of death in this condition? Pause here and answer the questions. It can be managed by use of glucocorticoids, physiotherapy, wheelchairs, and surgery for deformities. The most common causes of death are dilated cardiomyopathy and respiratory failure.
XY ready, XY ready, XY ready.